But the great thing about homeopathy is, in a way, it almost forces you to be a good doctor. It forces you to look at patients as a whole. You know, I work in University College London hospitals. Our hospital, the Royal London Hospital for Integrated Medicine, is part of University College London Hospital's very high-tech academic medical centre. And what you see is you've got more and more clever machines, more and more powerful machines, more and more diagnostic tests, and more technocratic, focused doctors who treat the scan or treat the blood test and not the patient. Of course, you must first be a good doctor to be a good homeopath. You must know how to interpret the scans and how to interpret the blood tests. But what you have to do is to treat the whole person. And you actually can't do homeopathy successfully if you don't. You have to look at the whole person. In terms of how I use it, I'm doubly accredited, if you like. I'm accredited as a rheumatologist and also in homeopathy. So that means I could practice conventional rheumatology and use all those very potent drugs that are in existence, a number have come online, and they're potent, of course, in two ways. They can be very potent in controlling disease, but the adverse effects can also be very, very potent. So a lot of my time, at least half of my time, I spend treating rheumatological patients with homeopathy and with integrated medicine, with homeopathy as part of an integrated package of care, which includes homeopathy, but also acupuncture, physiotherapy, exercises, cognitive behavior therapy, autogenic training, dietary measures, herbal medicine sometimes, a wide range of integrated measures for the very large number of rheumatology patients who actually, don't get satisfaction from conventional treatment. Perhaps the biggest two groups I see is osteoarthritis, the most common rheumatological symptom and actually one of the most common syndromes of all. Actually, we're all going to get osteoarthritis if we live long enough. 70% of people aged 70 have symptomatic osteoarthritis, and probably about 100% of them actually have osteoarthritis, even if they don't have much in the way of symptoms. It's, with age, it's a degenerative disease. With age, it is pretty much universal. And if you look at the official guidelines, NICE, the National Institute for Care and Health Excellence, publishes these guidelines. They're a pretty miserable document, actually. It says, take paracetamol, rub in non-steroidal gels, and wait until the joint's ready to be replaced. And otherwise use other, stronger and more dangerous painkillers. It's actually not a very encouraging document at all. The second most common syndrome in rheumatology is fibromyalgia, also very common effects depending on who you believe, around 2% of the population, much commoner in women, very common, and the treatment of that is even less satisfactory. You can do exercise therapy, you can do cognitive behavior therapy, and that's about it in terms of so-called evidence-based medicine. Although there is actually significant evidence that homeopathy works. I myself did a clinical trial when I was working at Bart's many years ago, which was positive, which shows that homeopathy does work, and I'm not the only one to have done work in fibromyalgia. So, there's huge areas of unmet need, what we call effectiveness gaps. Homeopathy is in the NHS and always has been. And, actually, let's be European for a moment. Actually, in most major countries, they don't have a quite analogous system. But in France and Germany, you can get it on the compulsory health insurance very often. And it's much more widely used, of course. In France, around 50% of people use homeopathy. Germany is not far behind. Countries like Belgium and Holland, similar, 30 or 40%, much higher actually than in the UK. But it should be used because it helps people, because many people find it beneficial.